This is Scott Becker with the Becker Private Equity Podcast. Thrilled today to be joined by David Pivnick, a partner at McGuireWoods, who handles white-collar litigation, particularly in the healthcare business, and a ton of it for private equity funds and private equity-sponsored companies. David talks to us about what trends litigation in the federal government, Department of Justice efforts, and more. David, let me tee it up and ask you to take it away. What are some of the things you're watching currently?
Yeah, absolutely. I'm currently focused on a few different areas of government enforcement activity. One of the things that I've been spending a lot of time focused on now and always, and we've talked about this previously, is how private equity is being viewed by the government and is being brought into some of the fraud and abuse cases that we're seeing. As you're aware, I spend a lot of my time focused on healthcare litigation and increasingly focused on representing private equity funds and their platforms. And so that's of interest to me. And I think the general sentiment that I would note is that the government is not pursuing, and I haven't seen, frankly, whistleblowers really pursuing private equity for the sake of private equity. In other words, not just because they've invested in the health is a private equity angle. It's usually where there's more direct conduct. So I'm monitoring where those cases are sort of going, what the trends we're seeing in terms of why those claims are being brought, which have included, issues that were spotted in diligence but not addressed appropriately in connection with the transaction, or where there were price concessions in the deal but not appropriate corrective steps taken with the government. There's also a lot of cases, or a few cases that have come out where there's kickback allegations where the private equity fund is alleged to have structured the improper arrangement and therefore gets brought in. But again, the good news, or the positive takeaway, I would say, is that we're not seeing a lot of those cases where it's basically just pursuing private equity just by virtue of having invested in the healthcare space. Another area that I'm actively monitoring is seeing how different investigations relating to the opioid epidemic are pursuing cases related to opioids on a lot of different fronts, ranging from improper prescriptions, selling prescription pads, issues with opioid manufacturers and how they've been conducting business and marketing products. And then of note to me and several matters I've been working on are the government looking at lab providers and practices in the nature in which they're providing urine drug testing, both in terms of the frequency and the nature of the tests. And then the other thing I'm looking at is sort of COVID-related issues. And for me personally, I'm less focused on investigations and claims that relate to PPP or other COVID-specific funds. And I'm more focused and have been looking at instances where the government has been looking at practices based on changes in the method of practice as a result, whether that's state licensing issues in terms of cross-state border practices, but also the practice and use of telehealth and things of that nature, where there's been shifts in day-to-day practice that the government has been reviewing for compliance purposes.
Fascinating. So some private equity funds being named in cases, but particularly not just because they have a healthcare company, because it's something they were involved in, it's some part of the diligence or acquisition where they had specific knowledge and were really involved in it. Still lots of opioid settlements and business going on. I saw Rite Aid recently filed for bankruptcy, and that came also out of the opioid crises. I also watched another recent Netflix sort of docudrama about the opioid crises called Painkiller, different than the one called Dope Sick, but unbelievably interesting TV to watch, if nothing else. At one point, there was a discussion about the COVID loans that were given and people using them for wrong purposes. Has a lot of that died away, or there's still some of those investigations going on?
There's certainly some of those investigations going on. It is not something that, frankly, has come up regularly in my practice, which may be more an indication of just it's not an issue that my clients have been dealing with than anything else, but it's certainly not something that I've been seeing with any real frequency in my practice personally.
Thank you very much. And any other sense of where the Department of Justice is at? I know there's lots of talk about antitrust enforcement against health systems, which seems so perverse given their sort of weakening position vis-a-vis payers. But any other issues you're watching closely or thinking about?
No, I think the antitrust angle is interesting, and I think it's also going to be interesting to see how things shake out in connection with non-compete on that front. And we talked about that before. But other than that, I think it's largely a lot of the key areas have continued to be key areas for the Department of Justice in connection with enforcement. That includes home health and hospice and all kinds of things related to the opioid epidemic. And I think that will continue. And the newer one is, like I talked about, seeing how private equity and other pockets of the different players in the healthcare space might get brought into some of these cases as they develop.
And notwithstanding so many efforts to curb the opioid overuse, addiction, et cetera, it seems like it is still booming in terms of challenges of opioid-related addictions. That doesn't seem to be, unfortunately, so many of the legal stuff has happened, the Purdue Pharma, the investigations of the big distribution companies, and so much more. But we're still looking at record sort of opioid overdoses and suicides. And so that harbinger of maybe more litigation in different ways. But it does seem, notwithstanding so many of these efforts by the government to curb or go after opioid bad actors, there's still so much trouble. I mean, it seems like so much use and so addictive, I guess.
Yeah, I think that's a very fair characterization of the situation. And I think, because of that trouble, because this is a situation where there are direct risks of patient harm and including death. I mean, it's very unfortunate, some of the consequences here, in addition to the significant money. I think those factors and the confluence is what's going to keep it sort of front and center for the Department of Justice, both frankly on the criminal side and the civil side, because it's something that is significant in the country. It has a major personal effect on people as well as the financial impact on the government risk. But that lots of avenues to pursue cases, whether it's against doctors for sloppy prescription practices to more nefarious things like selling prescription pads or selling prescriptions. There's the lab angles that the government has pursued. There's the companies, there's the cases and claims and investigations related to the actual pharmaceutical manufacturers. It's just an area that really, between the significance, to the country, which I think can't be overstated, and I think you summarized it well, in addition to the variety of legal angles from which the government can pursue claims, I expect it to continue to be significant in the future, and hopefully we'll see the actual epidemic slow down. But I think regardless, this will be a hot button issue for years to come.
Fascinating, absolutely fascinating. David Pivnick, partner, leader at McGuireWoods. I want to thank you for joining us on the Becker Private Equity Podcast. Always great to visit with you. Thank you very much.